Good morning, everybody, and welcome back to your Lunch Break Live. My name is Ivana Harinkiu if you're new here, and if you're not, thank you for coming back. Today is Thursday, January the 13th, and today we're talking about COVID and specifically the Omicron surge that we have seen across the nation and in Alabama. We know that Alabama has had record-setting case numbers, reporting over 10,000 new cases a day, which is an all-time high for the state in this pandemic. So today I am joined by Alabama Hospital Association President, Dr. Don Williamson. Dr. Williamson today is going to talk a little bit about how hospitals are faring with this surge, about the variant in general, and answer some questions. So, Dr. Williamson, thank you for joining us. I know that you are probably busier than you'd like to be at this time, and I know that your schedule is precious. So, thank you.
Glad to be here. Thank you.
Doctor, I want to first start with something that you and I were just talking about off camera. And this is the notion that we have all heard that Omicron is a less severe variant of COVID. So I know you have some thoughts about that. But first, tell me, is it less severe? And does less severe equal mild?
Well, I think you've hit on probably the most important message. If you look at the way it's being reported, it is absolutely less severe. Now, let me put that in context. Less severe does not translate to no harm. An example is Delta puts you on a ventilator. Omicron puts you in the hospital needing supplemental oxygen. Yeah, that's less severe, but that's not the place you want to be. So in context, there's no question. If you look at Delta, we saw about 10% of people who got Delta had to be hospitalized. With Omicron, it's about 3%. That doesn't mean that nobody gets hospitalized. It means 3% of people who get Omicron are going to end up in the hospital. Delta, in our experience, caused about 2% of people who got it to die. The data shows that Omicron causes about half the deaths that Delta does. Again, that doesn't say people won't die from Omicron. It just says they're less likely to die. And so when we talk about 10% versus 3%, 2% versus 1%, those are numbers based on a large population. So as an example, if I have 10,000 people with Delta, 10% of them, or 1,000, are going to end up in the hospital. If I have 10,000 people with Omicron, about 3,000 are going to end up in the hospital. The difference is those are population numbers, not individual numbers. So you don't know as an individual whether you're going to be in the 97% that don't need hospitalization, or you're going to be in the 3% that does need hospitalization. So people need to be very careful when they start saying Omicron is less severe. It is on a population basis, but on an individual basis, we have people right now in Alabama hospitals with COVID, with Omicron, who are in the ICU, who are being ventilated, and some of them are going to lose their battle to Omicron. So I just would caution people, please don't assume this is somehow mild. Please don't assume it's simply the common cold, because it isn't. People will die from Omicron. The people at greatest risk are the unvaccinated. So, our message is consistent: vaccinations, boosters, and masks.
Well, and I want to get to vaccinations here in a second, but before we get there, I want to ask you kind of a quick population numbers game here. If you have Omicron being less severe in terms of severe illness, but also infecting maybe double the people that previous strains, previous variants have, aren't you going to end up with roughly the same number of people who are needing that type of hospitalization and in care?
Well, you actually may end up with bigger numbers. I mean, as an example, during Delta, we often saw 3,000 cases a day, and we would have hospital admissions of about 300 a day. Now, we're seeing numbers of 11 to 12,000 cases a day, numbers we never saw with Delta. And with 3% of them being hospitalized, yesterday we had 379 people hospitalized with Omicron. Our hospitalization numbers are rising at a rate at least as rapidly as with Delta. Now, the good news, and there is good news, and that is our ICU and ventilator usage is less It's not rising at the same rate now as it did with Delta, but it's still going up. We've gone from about 100 patients in the ICU at the 1st of December to 400, 398 yesterday. We've seen our ventilator use go from about 60 to almost 200. So it's going up. And while, yes, fewer people may need the ICU, fewer people may need ventilators, it's not zero. It's, it's Omicron, and some people, unfortunately, are going to have bad outcomes.
The ICUs, we were talking about ICUs capacity limits as well. I know that you said ICUs are starting to fill up. Now, I had numbers here from Tuesday from the Alabama Department of Public Health that show 1,925 people are hospitalized with COVID. Again, that was as of Tuesday, so I know that number is a little dated now, but that's an increase of about 400 from the week before. So
Right.
these ICUs are filling up, and these hospitals are filling up with patients. So
That's
let me ask you what you think about that, number one, and also how severely sick are these patients? How many patients are on ventilators?
Well, yeah. In fact, yesterday's number, we went over 2,000. I think we had 2,043 patients in the hospital yesterday. And you're right, ICU capacity is going down. Yesterday, we only had 113 ICU beds available statewide. Alabama was one of 4 states that had fewer than 10% available ICU beds. And specifically, we had certain parts of the state in the in the Montgomery to Opelika area and down in the Dothan area, there were more people in ICUs in ICU beds than there were designated ICU beds. So we were negative numbers in those areas. In Birmingham and in Mobile, both of those areas had fewer than 10% ICU beds. In fact, both of them had ICU bed availability in the teens. And those are obviously very large markets. And so the ICU bed capacity is now being extremely stressed. That's compounded, frankly, by a phenomena that we did not see with Delta. Delta was vaccination and booster was very efficient in reducing the risk of breakthrough infections with Delta, probably about 95% effective. Omicron has the ability to evade the protection afforded by vaccine in a way that Delta didn't. And there's some Pfizer data that shows that 2 doses of vaccine is only about 35% effective. 2 doses of vaccine plus a booster is about 70 to 75% protective. But what that means is there's a much greater chance of individuals who've been vaccinated and boosted getting Omicron. And we're seeing that now in our hospitals. We've got hospitals with literally hundreds of employees out because they have Omicron. And they're not just all nurses. They're nurses, they're people who clean the rooms, they're the people who register folks, they're respiratory therapists, they're physicians. And so our ability to respond is even more compromised now than it was back in August, September, or even in January of last year. And so while we aren't at the same level of hospitalization or the same level of ICU bed use, the stress on the system is at least as great now as it was earlier last year. So when I look, as you mentioned, at ICU beds, we've gone from about 100, actually 95 to 104, depending on the day, around the 1st of December. To yesterday, we had 395 people in the ICU. We've gone from ventilators of about 60 to 188 yesterday. Again, those are not the 800 that we had in terms of ICU in August, September, or the 600 in ventilators, but we're clearly seeing an increase. So what all of that tells me is that for patients, especially the unvaccinated, that Omicron is not a benign illness. It is putting people in the hospital. It is putting them in the ICU. And unfortunately, we've reported over 100 deaths so far from COVID during the month of January.
And it is only the 13th. We're not even 2
Right. Oh,
weeks
yeah,
into
you're right.
January, not even 2 weeks into the year. Now, that's interesting because we have only seen these reported numbers on the COVID dashboard from the state. They're only reporting about 8 deaths so far in 2022.
Yeah, deaths lag from what we see in the hospital to what gets reported by the state. They lag for 2 weeks, a month, as the state goes in and verifies those deaths. So we're seeing in real time in the hospitals patients who die in the preceding 24 hours. So our numbers in terms of what we're seeing with death is always going to anticipate what the state's going to report over the coming month.
And over 100 is a big number.
Well, it is compared to when you try to compare that to the idea this is a benign illness. I mean, clearly, we don't have 100 people die in 2 weeks from the common cold. We don't have 100 people die in 2 weeks from regular influenza. So clearly, this is not regular influenza. This is not the common cold. This is, unfortunately, a variant of the COVID virus, and it is unfortunate. It is better than Delta, but again, it's better only in the sense that you're not on a ventilator. You may be getting supplemental oxygen.
Well, you mentioned 2,043, I believe, patients who are hospitalized with COVID, as I think you said yesterday. Now, of those people, do we have an idea of the ratio to unvaccinated versus vaccinated people who are hospitalized?
Yesterday, about 65%, and I divide this really into 2 groups. I divide this into individuals who are fully vaccinated versus individuals who are not fully vaccinated. The not fully vaccinated group are those individuals who have no vaccine, which is the overwhelming majority, or individuals who maybe had 1 dose of a messenger RNA vaccine. About 65% of our patients yesterday were not fully vaccinated. About 35% had at least 2 doses. But and that's exactly what you would expect given Omicron and the fact that you get a breakthrough of around 30% in individuals who've had 2 doses. Now, if you look, we're now beginning to collect data and have data now for about 2 or 3 days on boosters. And while it's still too early to make a lot out of this, I can tell you that for individuals who've been boosted, they account for a very small, less than 5% of the inpatients with COVID. So clearly, being fully vaccinated with 2 doses makes a difference, drops you from the 65% group into the 35% group, but then getting a booster drives your risk of being hospitalized down even smaller.
That's a very big piece of data for people who want to argue that vaccines don't work, and especially that vaccines don't work against Omicron. That's a big piece of data there. And I want to clarify one thing. You said that on those patients and that percentage that you tally as fully vaccinated or partially vaccinated, you mentioned that they had 1 or more doses of the mRNA vaccine. So are you not including people who have had a Johnson & Johnson vaccine?
No, we include Johnson.
Okay.
All right, so when I talk about fully vaccinated, the 35%, I'm talking about individuals who've had a minimum of 2 doses of messenger RNA vaccine, which is either the Pfizer or the Moderna, or 1 dose of Johnson & Johnson. That's fully vaccinated.
Got it.
Booster are individuals who've gotten an additional dose of messenger RNA vaccine.
Understood. Got it. Thank you for that clarification. Now, I want to quickly go back to hospitals here in a capacity limits. Now, we know that at the beginning of the pandemic, we saw hospitals across the state and really across the nation that are having to cancel surgeries that were called either maybe elective. I think that sometimes that's a misleading word, but not emergency surgeries due to capacity limits. Are we close to that in Alabama?
We're already seeing that. We've already got hospitals that have terminated all inpatient elective non-emergent surgeries. I've got several hospitals that have already done that. We've got other hospitals that are looking at that. I think our situation, the best way I can say it, our situation is deteriorating fairly rapidly. While we have 11,000 cases yesterday, I would remind people it takes about a week to 10 days from people being diagnosed with COVID to ending up in the hospital. So our COVID numbers for hospitalizations are likely going to rise over the next 7 days, even if we were able to see our COVID diagnoses stabilize or go down. We're likely to continue to see our hospitalizations rise over the next several days. And we're already stressed. As I said, we've already got hospitals that are canceling non-emergent surgeries that are going to end up in inpatients. We've already got hospitals that have diverted staff from elective procedures to take care of patients in the hospital. And we anticipate this to worsen. And it's worsening at the very worst time when we've got staff that are out with COVID.
You said that you expect it to rise in the next week or so. Do you expect the peak of this surge to be in the next week, or when do you expect that peak to be, and when do you expect us to start falling back down?
Well, I think it was Yogi Berra who said it's hard to make predictions when you're talking about the future. If you look at what's going on the East Coast, it appears from some data that maybe they are peaking now. If that's true, we're maybe a week or so behind them. So maybe we peak, what's this, the middle of January, maybe we peak in terms of new cases sometime next week. Then maybe we peak with hospitalizations by the end of the month. And I view that as a win. If that happens, that will have been a win. But I have no guarantee that's the case. I mean, just because things seem to be flattening right now does not mean in New York and the East Coast does not mean that it will continue flat. The best predictor of what's going to happen in the future is what's happened in the past. And what we know is that we generally see a rapid increase. We see a short plateau, and then we have historically seen a fairly rapid decline. So, as I think about this, I'm thinking of hopefully seeing this by peaking in our hospitals by the end of January and seeing those numbers come down during February, and hoping that by March we're back in a more manageable situation, and hoping that we then don't have to deal with another surge later in the year.
That was my next question. You say that the past is the best predictor of the future. You lay out that scenario. Now, what we have seen in the past is these variants, at least since Delta, have gotten slightly less severe. Again, I'm not going to use that word mild after what we talked about earlier, but slightly less severe than Delta. So if Omicron is slightly less severe than Delta, would it be fair to predict that if there is another variant that comes out of COVID-19, out of the COVID-19 virus, that will be less severe than Omicron?
Well, I mean, if you look at how natural selection works, living organisms have as their goal reproduction. And so given that Omicron needs a host in order to survive and propagate, viruses tend to mutate in a way that makes them more infectious, but less deadly. If the virus kills its host, it limits its ability to be transmitted and to propagate. So one would predict that Omicron followed the pattern that you would have expected. It is more infectious, so it spreads. It is more easily capable of infecting more people, but it is less deadly in the aggregate sense, so that it keeps its host alive so that it can spread to other people. Now, that's the theory. What have I learned with Delta is Delta will do what Delta does. I mean, if you think about it, Delta was not the first variant. We dealt with the native virus back in 2020. Then we got what's called now the Beta variant, or the Kent variant, which was the UK variant. And it was no more deadly, but maybe a little more infectious than the original variant. Then along came Delta, which was much more infectious. Now, I think there's still debate about whether it was more deadly or not. Maybe it was, maybe it wasn't. Maybe just more people got it. But we didn't see it. It certainly wasn't less deadly than the original variants. We see now Omicron, which is clearly more infectious than the Delta variant, and it does appear to be less infectious, or less deadly. You can use the analogy that the next variant, which, if I remember the Greek alphabet, is pi, the next variant would in fact be more infectious and maybe less deadly. I think there are a lot of things that will determine whether we have another surge. One of the most important ones of those is what immunity does infection with Omicron convey, and how long does it last, and what level of immunity does vaccination confer. If, for example, Omicron provides protection as rapidly as it's spreading, and I'll take what CDC and Dr. Fauci said to be right, most of us are going to either be exposed to it or get it. You could have very high levels of immunity in the population. And if Omicron is an effective natural antibody producer, and those antibodies are protective against the next variant, you might not have another surge. That would be the absolute best scenario. On the other hand, if Omicron doesn't provide long-term protection, if a new variant emerges that can break through our vaccines, then we could absolutely have another surge. I can certainly be optimistic that this could be the last of our great surges, but I'm also realistic enough to know the virus is going to do what the virus is going to do, and we don't control that.
I'm going to take that word of optimism and try to hang on to that one, Doctor. We have just a few more minutes. I want to get to a couple quick questions here from our readers. I have one question here, and I cannot find this person's name. I believe it was Kathy, and Kathy says, should people who have had the Johnson & Johnson vaccine get a booster? And if so, what type of shot should they get a booster of?
Well, I think it's a messenger RNA. I'm actually my recollection is that there's not been an official recommendation on the Johnson & Johnson vaccine. And so I'm going to defer that one. I'll try to get back to you. I need to look at that. But it's going to be a messenger RNA vaccine. It's going to be the recommendation.
Question from Nancy. If you have Omicron, will you have immunities? And if so, how long do we think that those antibodies will last?
We don't know. I mean, that's the problem. We know that natural antibody. Well, here's what we know. We know that people who got infected in a study they did in Kentucky and then didn't get vaccinated were twice as likely to get COVID again compared to people who had COVID and got vaccinated. So it appeared that natural antibodies didn't persist at high enough level to prevent subsequent infection, at least in one study. Those antibody levels got boosted dramatically by vaccination. So the advice clearly is, even if you've had Omicron, you need to get vaccinated, because we don't know how long antibodies are going to persist, and we don't know how protective those antibodies are going to be.
If you have had Omicron, or if you've been exposed to somebody who has been diagnosed with COVID, we can assume that it's the Omicron variant, even though we might not necessarily have that paperwork, right, to say that. Should you go ahead and get a booster, or do you need to wait to see if you come down with symptoms before you get boosted?
Well, I think a booster given right after an exposure is going to have no effect in protecting you. It takes about 2 weeks for the vaccine to boost your immunity. So the general thought here is, if you're going to, with Omicron, within 5 days, you're going to know if you're ill. If you haven't been boosted, if you get exposed, I would tend to wait until after I know I have not gotten Omicron, because you don't want to confuse the side effects of the vaccine with the illness.
That's a good point there. Dr. Williamson, I know that we have to let you go, but you've given us so much great information, so many statistics to sit here and think about. So thank you so much for your knowledge here. And we'll have to get you back to answer some more questions later.
All right. Thank you very much.
Doctor, thank you. Everybody watching, thank you so much. And make sure you tune back in tomorrow. Have a great